paid for the purchase of the snow cones, and then I paid this last time, and she'll come one more time. They'll come one more time next month before school starts. And the son is handicapped, but
Mhm.
he does all the scooping of the ice and packs and makes the snow cones for the kids.
Oh,
So
wow.
so it's a real good um, interaction with the people that they're not usually around, and then
Mhm.
the community's involved in it, and it's just a I think it's really good for both of us.
Awesome. I love that. I love that. Now that is definitely a nice way to stay cool in this heat. Snow
Yes,
cones. Who wouldn't love
yes,
it?
yes.
Absolutely. Let's see. We have Jennifer Moss says spending time with my grandkids. Yes, I bet that is a great way to spend the summer. Let's see. Uh, oh, Miss Farletta says they go to the local pool daily. It's great to see them grow and their ability to swim. Yes, absolutely. Thank you all for those. Thank you for your comments. Any more before we move on? All right. Well, thank you all for that. We will go ahead and get started with our presentation. Again, I just wanted to say welcome. So glad that you all could be here. And I will pass it over to who's up first?
Miss Rachel, I
I am.
believe, is on deck.
All right. So, let me switch this slide. Sorry. All right. So I am, like I said earlier, the emergency preparedness consultant, and I would like to share some ways that I can support you. So child care facility regulations require you to develop an emergency plan for the safety of the children and staff in emergencies such as fires, tornadoes, storms, floods, and serious injury. The plan should be posted in a conspicuous place in the facility, and the emergency plan should also be shared with parents and legal guardians of each child enrolled. Each person caring for children, including each substitute, is to be informed of how and shall follow the emergency plans. The required plan should address these types of emergencies that are likely to occur in or near your facility, including fire, weather-related events, missing child, chemical release, utility failure, acts of violence or terrorism, or other situations that might require either evacuation, lockdown, or shelter in place. So there are 4 main types of hazards. A natural hazard are events such as floods, earthquakes, winter storms, wildfires, or tornadoes. I knew I was gonna mess up on this. Technological hazards are events caused by a malfunction of a structure and or some human error in controlling or handling the technology, like gas leaks, power outages, dam failure, industrial explosion, nuclear plant leak, or hazardous materials. Biological hazards is a substance that poses a threat to the health of primarily humans, which include contaminated food outbreaks, infectious diseases, or toxic materials. And lastly, safety or man-made hazards. This involves an element of human intent, negligence, error, or failure of a man-made system. So that would be your active shooter, bomb threat, criminal activity, cyber attack, and intruder. So what can we do to help providers? Well, we understand that focusing on all the hazards your program might encounter can be overwhelming. So together we will complete a risk matrix to determine the hazards that pose the most risk in your area and help you prioritize your planning and your preparedness. We can help make an emergency plan with different response options and include children and adults with all levels of abilities, such as children with wheelchairs, adults with sensory impairments, children with supplemental medical devices, food allergies, and safe transportation of medications that require refrigeration. And we can also help facilitate practicing those drills. We can give you information to connect with local resources and gather first response agency information like your county's emergency management team, local police department, and your local fire department. We can help plan for utility outages and show you how to use your emergency shutoffs, including electricity, gas, and water. You should also train your staff on how to use those shutoffs and have it marked on your evacuation map, just in case you're away from the facility. Also, you should know your utility providers and have their contact information posted. We can help practice responses to a variety of hazardous scenarios, like your active shooter or flash flood, just to name a couple. We can help with a written schedule for you to keep track of things like your CPR and first aid trainings, or any drills that you might do throughout the month. And remember, drills should include all ages of children, every employee, every volunteer, and should be done at varied times of the day. You should update your plan after a drill or a real emergency. If you have changes in your facility size, changes to your evacuation or shelter site, or changes in state or licensing requirements. We can help also with developing a communication and reunification plan. Without communication of the plan, parents don't know what to do. First responders may not know where you are, staff panic, and children are unprotected. So developing a family communication and reunification plan so families can stay connected is one of the most critical components of protecting children in an emergency. So you want to develop a communication plan and then a backup plan and a backup for the backup plan, just to play it safe. And lastly, we can help assemble emergency equipment and supplies and discuss where to store them and what transportable or durable containers work best. Emergency kits should be placed in easily accessible locations on each floor of the facility, in evacuation sites and evacuation vehicles. So lately, I have been working with providers that want to either add or update their active shooter policy. Here's a video of an active shooter event that happened outside of an Ohio child care center. Many providers might think this will never happen to their program. We live in a good neighborhood or whatever it may be. You never know. Anything can happen. You can have a tornado. They say more earthquakes are coming to Kansas. Great. So just making sure that your plan is prepared for anything that might happen. So during this video, I just want you to think about your program.
Tense moments at a local daycare after workers hear gunshots outside their building.
Just one station with a story of a teacher and her amazing bravery to save those children. Our Caitlin McCarthy spoke with her about what unfolded.
My thing was, don't let our kids get shot. I'd rather for me to go than one of them babies to get shot.
The most frightening day in the 38-year teaching career of Zenobia Morris.
And all of a sudden we just heard gunshots just coming out, and I just looked like I got to get the kids' house.
Those gunshots right outside their classroom window. Within seconds, Morris brought all 8 students between ages 2 and 8 to safety.
So the kids had to drop on the floor from here and crawl to this door, which is our toddler room, which is no windows in here.
Morris says the victim and the suspect have no connection to the daycare.
And she just so happened to pull in to our parking lot because her tire was shot and found out there was bullet holes, and then you just got out and just got to shooting.
Morris is devastated these children had to experience such a scary situation at a place where they're supposed to feel safe. She's also heartbroken for the victim.
I really couldn't sleep last night. And I just kept thinking about if she made it, and you said she didn't, so that's really hard.
Morris should be called a hero for her bravery. However, she says she was just doing her job.
I really didn't think about it. Like, I just thought about me just doing my job, then being a teacher. But when you think about it, yeah, but it was just the safety of the kids.
The daycare will be closed until Tuesday while police continue to investigate. The suspect was caught last night, but his relationship to the victim has not yet been released. Reporting in Maple Heights, Caitlin McCarthy, 19 News.
So now that you have seen the video, I have some questions for you. What would you do? Do you have a plan in place? Have you practiced that plan with your staff and children? What could you do to help children and staff cope after an event? So if you're interested in updating your emergency plan or would like to create schedules and checklists or just have questions, here's my contact information, and I would be more than happy to assist you. Thank you, and now I will pass it over to our nurses.
Thanks so much for that, Rachel. There are a lot of elements that go into emergency preparedness, a lot that we oftentimes don't want to have to think of, but we prepare for the worst and hope for the best. And we're lucky to have you as part of the team to be a resource for that. So I am one of the childcare health consultant nurses. There's two of us. You were already introduced to Miss Jessica, and we can help with some of the things listed here in the bulleted statements. I'm just going to flesh out the details of that a little bit. And first, just wanted to say thank you to the childcare providers for giving us a portion of your evening tonight. We know that your time is precious, and we appreciate that you have dedicated some of it to spend time with us, because we're excited about the things that we can do to help and to get to share that information with you guys. But as nurses, we have experience with looking at immunization records. We can help if you need, a process for keeping those immunization records tracked. That is something that is required by the state, that you have current childhood immunization records for your kiddos. And those can come in a variety of formats. So sometimes you get, an immunization record that's a little bit patchworked, pieced together. You've got some from the health department, some from the child care provider. If you're in that situation, we can definitely help you navigate that. Exclusion and illness for children as well as staff. We've done a lot of this, especially with the pandemic going on, just looking at those illness policies for providers, giving some feedback and suggestions there. Daily health checks, we can define what that is, why you should be doing it in your program for your staff and your children, and when to be doing those. Special needs, kiddos that have, chronic health conditions, maybe, good examples, diabetes, asthma, epilepsy. We can help you figure out what documentation to have in place there to help you or your staff be able to properly address some of those needs. Scheduled and rescued medication administration. There is paperwork that the state requires that you have in place. So questions like, how do I document that I gave these medications? How do I know what to look for on a prescription label? What do some of the terminologies on those prescription labels mean sometimes? How do I store those medications if they're brought to my program? We can assist with those types of questions. And then bloodborne pathogen education. And next slide. And some of these overlap a little bit with the previous slide, but if you have kiddos in your program with special needs, for example, asthma, you do need to know what steps to take to help them if an emergency occurs. And those steps are easily articulated on a document called a medical action plan. So we can help you if you're not familiar with what that is or what should be filled out on it. If you get one turned in from a doctor, we could help you navigate that if there's some terminology on there that you maybe don't understand, or if there's more questions that we need to be asking of the parents or the healthcare provider, we can give guidance with that as well. I talked a little bit about illness policies. Again, that's kind of the star of the show right now, just talking about, with things changing rapidly with COVID, what's the quarantine period? What's the isolation period? What does that look like in my program? And then of course, just the other run-of-the-mill common childhood illnesses as well. Assisting with mental health questions and providing strategies to help children, staff, and cope. This is a challenging world without a pandemic. So you layer that on top of it, and some good and some bad things have come out of it. And one of the good things I would say is that mental health is now highlighted as a priority. So we can talk to you about some preventive things that you could do, some different activities that you could incorporate with your children and your staff to promote wellness. We talk a lot about nutrition and physical activity, but right up there with it is what are we doing to calm ourselves and to cope with things. So we can definitely give you some strategies with that. I mentioned bloodborne pathogen on the previous slide, but to explain that further, we can help you determine the contents of a bloodborne pathogen spill kit. So we all get that training when you come on board as a new provider, but have you thought, especially if you're in home, like what kinds of supplies you should have readily available to address that if it happens, if you want to take that to the next level and have a written plan that you keep up on the wall. When an unexpected event happens, it can be stressful. And so it's nice to have those resources already planned and ironed out, just to aid you in how you respond to those types of situations. We can give advice on safe sleep environment. When we do consultations, we do draw our information from credible resources like the American Academy of Pediatrics, Caring for Our Children, what does the state say? So we do draw from best practice, evidence-based resources when we give advice on things like safe sleep. We, again, can review immunization schedules and requirements if you have questions there, and then provide resources and support for breastfeeding friendly childcare providers. We can loop you into what that looks like. If you are interested in being a breastfeeding friendly childcare facility, that you can earn a designation that is listed in WLS, and that can really set you apart from the childcare provider down the street. It's just taking a few extra steps to create a space that's comfortable and clean and accessible to families, whether the mom wants to come in and nurse baby or pump. It also, gives you some familiarity with when a mom brings in breast milk, how do you store that? How is it handled? So just to kind of get your comfort level up there. And that can be really appealing to some of those families that want to come in and continue to breastfeed when their child goes back to care. And next slide. So that's me. Jessica and I have the state kind of divided, the northern and southern half, really just for logistic purposes. So if we did in-person visits, we'd be able to geographically be, closer to some providers based on where we live and work. But I came from Fort Riley. I worked as a public health nurse for several years, and then through that experience, I got to go into childcare facilities, and I absolutely loved it. I worked with family childcare providers and in some of the center-based facilities. And so when an opportunity became available for me to become a full-time child and youth services nurse, I moved into that position, and I did that for a few years as well. So I had the opportunity there to teach our childcare providers CPR and first aid, bloodborne pathogens, communicable diseases, and medication administration, and go into facilities and, help those providers, talk to lots of parents. So it gave me really good amount of experience there. And next slide. This is Miss Jessica, and she works out of the southern half of the state of Kansas. She worked at a hospital for a while and got some good floor experience there, and then transitioned to a role as a home health nurse. And she had the opportunity there to provide specialized care to children with medical needs. And so she brings a wealth of knowledge and experience to our team as well. And I think that's all we have. Handing it over to Miss Bridget.
All right, thank you, Erica. That was great information. So again, my name is Bridget Banks, and I am the Health Equity Consultant for the Child Care Health Consultant Network. And I'm going to talk to you about what I do in my position. So first, let's think about the definition of health equity. Oh, sorry, I got to get my glasses on so I can read. Okay. All right, I'm sorry. Found my glasses and found my thing. Okay, so health equity means everyone has a fair and just opportunity to be healthier. That requires removing obstacles to health, such as poverty, discrimination and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education, housing, safe environments, and healthcare. So basically, what that means is, well, let me say this. There are different definitions of health equity, but this one kind of speaks to the social determinants of a lot of people of color face. So basically, an equitable classroom ensures that all Kansas children have access to quality care that meets them where they are. For that to happen, all Kansas early childhood education programs should be intentional in addressing barriers in equity, inclusion, and access in their practices, policies, curriculum, and environments. It is important that we check implicit biases in our children's classrooms. And we must remember that equity is an ethical responsibility for all professionals working in early childhood. Next slide, please. All right, so how can a health equity consultant help programs and providers? I can work with providers to help create healthy, equitable, and thriving early childhood education communities by looking at the root causes of inequities and disparities and identify any gaps via a self-assessment. And based on the results of that self-assessment, I may work with the provider around topics like cultural humility and responsiveness. I can recommend adjustments to create meaningful inclusion for programs and families, and recommend resources for culturally responsive room design. I can even help with looking at ways to recruit, welcome, and retain families and staff from diverse backgrounds. Next slide. As with all the Child Care Health Consultant Network tiers, my consultations are provider driven. I'm happy. I'm here to help with any support in any way that I can. Soon I will be able to help with training for program providers. I'm also working on networking and support for providers of color that gives them a platform that allows them to be their authentic selves in a safe space. And we plan to call that, it'll be NETS, just like the NETS that we're having now, but it'll be NETS BIPOC, dedicated to our Black, Indigenous, and other people of color. So if you know any providers of color that you think would benefit from this opportunity, or if you feel that your program could benefit from a health equity consultation, please feel free. Don't hesitate to reach out to me. This is my contact information here. Again, Bridget Banks, I am the Child Care Health Equity Consultant. My direct line there is 785-833-6567. Or you can email me. I'm fine with that, however you want to reach me. You can also go through our intake process and our Child Care Health Consultant, why can't I talk? Our Child Care Health Consultant Network Program Assistant, Tanisha Edwards, will send you my way. And that's all I have for me. Thank you so much for allowing me this opportunity to speak with you about what I do. And now I think we're going to open it up to questions. We are here to answer any questions that you have.
And I just want to take a moment really quick before you guys have questions, because I know the ladies went over and kind of explained a little bit about what they can do. It is definitely not all inclusive what they added on this, what they shared with you. So if there is something that you're thinking about, like I've always wanted to work on this, or I've always wanted to do this, but you're not certain if it falls into their scope of work, it never hurts to ask. All of these ladies are fabulous and none of them bite. I promise. I work with them on a daily basis and I have never gotten bitten. So if you have a question or if you're not sure if it falls there, just reach out. They will either tell you whether or not they can support you, or will get you pointed in the right direction with maybe one of our other tiers or projects within Child Care Aware of Kansas. So I just wanted to throw that out there.
All right, thank you, Ms. Heather, for that. All right, Miss Judy, I see you came off mute. Did you have something that you wanted to ask?
Well, I didn't mean to, but I did want to get the nurse's name that was speaking a while ago. I didn't get her. I think she was speaking about the policy, the different policies that should be practiced in your daycare. Like the one I was interested in was like a shooter, the drive-by shooter, and how to plan on something like that, or how to.
Okay, that's like Rachel.
Like you said, you never plan on it, but and like I live in a small community, but you need to know what to do. You need a plan just in case. But that was Rachel.
Yes, ma'am.
Yes, ma'am.
Okay. Where do I find her information? Her phone number, email, and.
Yep, I was gonna say.
Miss Judy, I have your information, so I will contact you and
okay.
we can set up a consultation.
That'd be great.
Oh, it's in the chat. All right.
Okay, thank you.
I was trying to be quick with my fingers, but sometimes my mind goes quicker than my fingers. So
that worked good. Thank you.
Wonderful.
I hope you all learned something new that maybe we could help you with that you hadn't thought of before. And I think we're we're probably all operating under the same understanding, but our services are at no charge. And if you need something, you're not obligated to work with us for a certain period of time. If you just want help with a specific question, we're here. If you want to work on entire projects, we're here to help you do that too.
Definitely. Thank you for mentioning that, Erica. And also, if you have any questions for the Child Care Health Consultant Network, other than the specialties, we are here to answer those questions as well. Any team members from Child Care Aware of Kansas have any questions for us? Wow, I guess that means we did an amazing job giving out information. I like to think that's the case. I hope so.
Yes, ma'am, Bridget. I think you did. I think you guys did a great job.
So that's great. But we are here. Please don't hesitate to reach out. You can have our contact information, I think has been dropped into the chat. Also, you can always go to the website. We can be reached that way as well. I didn't mention that, but you can also reach us through the website. All right, thank you. All right, my team, do you have any final remarks that you would like to leave with our wonderful providers? Nope.
Miss Bridget,
Yes.
I would say, I just want everybody to know that if they are working with one of the tier 2 health consultants, that they would be able to connect you guys if they miss your information somewhere. So we can connect those dots and co-consult or refer them to you at their request.
All right, thank you, Miss Mary. Miss Mary is one of our wonderful tier 2 consultants. Thank you for that. And you can definitely get to us through our tier 2 or tier 1. Any of those consultants that you're speaking with, they can connect you with us as well. Thank you, Miss Judy. We're here whenever you need us.
Thank you.
All right. Okay, well, again, we just want to give you all a big thank you for spending a part of your evening with us. And we know that you're busy, and we're so glad that you took the time, to spend with us in your evening. We can't say how much we appreciate you and all of the work that you do for Kansas kiddos. And we look forward to meeting and talking with you all again. Thank you. Have a great night.